Let's talk about MAP. You know why I want to talk about MAP today? Because it's the most ignored blood pressure parameter when nurses or healthcare providers are taking blood pressure measurements. And MAP simply stands for mean arterial blood pressure. And what is mean arterial blood pressure? It's the pressure exerted by blood in the arteries. And why is it called mean? Because we calculate it from the diastolic and the systolic, and we find the mean. There's a formula. Stick to this video. I'm going to show you. So a normal MAP for an healthy adult is usually 70 to 100 millimeters of mercury. That's the mean arterial blood pressure for a normal healthy adult. But it may vary depending on age of the patient. Like pediatrics have a little bit lower MAP. Sex, like men, have a little bit higher MAP. Things like age, things like body weight, and underlying clinical conditions like diabetic patient, hypertensive patient, patient with heart blocks, they do have varying MAP. So we say that your MAP is below the normal range when it is below 70, and we start thinking on how to intervene it. When it is above 100, we say it is high MAP, and we start thinking on how to intervene it. So when your patient has low MAP, I'm going to tell you what conditions should you think about. When your patient has high MAP, what conditions should you think about? This is very important. It gives you an impression of the cardiovascular system of the patient. So it's very important to take note, even if you are in an OPD taking blood pressure of the patient, or you are in a screening area screening patients for blood pressure. You have to be very attentive. But what MAP indicates is tissue perfusion, cardiovascular health, cerebral perfusion, systemic vascular resistance, and cardiac output. Systemic vascular resistance and cardiac output. You know what? When you have a normal MAP, that's an indicator that your tissues are well supplied with blood, nutrients, glucose, and all the necessities that blood needs, that tissues needs. You know, it's an indicator that you have a good cardiovascular health. When your MAP is normal, that means your heart is normal. No dysarrhythmias, no heart blocks, no heart artifacts. Cerebral perfusion, when you have a good MAP, possibly your cerebral is well perfused, well supplied with blood and nutrients. Systemic vascular resistance and cardiac output. When you have a normal MAP, that means heartbeat or stroke volume and heart rate are known. So now let's calculate MAP. Assume you are in clinical setting where you are using a manual blood pressure machine or sphygmomanometer. Usually this is the formula on how to calculate MAP. MAP is equal to systolic blood pressure plus 2 times diastolic blood pressure. Then you divide all this by 3. Remember, MAP is a mean, an average of 2 pressures, that is systolic and diastolic blood pressure. So assume you have a patient with 100 as the systolic blood pressure, millimeter of mercury. Then you will add 2 times 2 that diastolic blood pressure that you got. Assume it is 50. Then all this you will divide by 3, and this is 200 divided by 3. And what will I get? What will I get as MAP is approximately 67, because we have to round off the decimals. So 67 is the normal blood pressure for this patient. There are many formulas to calculate MAP, but this is the easiest one and most recommended in clinical setting. When your patient has low MAP, number one, what will come to your mind is the patient is in shock. That is, most areas are not supplied well with blood. And such kind of shock could be hypovolemic shock, could be cardiogenic shock. We could have anaphylactic shock. We could have hemorrhagic shock. Those patients with traumas, they have visceral injuries. The other thing we could think about is dysarrhythmias, possibly to heart conditions, like we can think about complete heart block, 3rd degree usually. We could think of AFib, that is atrial fibrillation. We could think of VTAC, that is ventricular tachycardia, and many more. These are just but few quick examples of MAP. Others like dehydration and many more. High MAP, when the MAP is too high, one, we could think of fluid overload, and this possibly could be due to severe hypertension. And with this, your patient could have a number of conditions like pulmonary embolism, pulmonary hypertension, and things of that kind. Possibly this patient will need diuretics and multidisciplinaries to review, like nephrology team and so on. This is just a few quick tips that you have to think about when your patient has high MAP. Note that you should not be quick to say that your patient has high MAP or low MAP. Just like blood pressure measurement, we need to take time to identify this. but this should not take days. It's just within a few hours that you have to rule out. And we consider a map that is below 50 to be very severe. At 55, 62, we can say our patient is still, we can be still studying or monitoring to see what is wrong with our patient. But at 50, below 50, you have to intervene quickly. Possibly in most settings, we introduce ionotropes like noradrenaline, adrenaline, and other managements like fluids. And if your map is above 120, this is very severe, and you have to think on how to intervene. And we could introduce antihypertensives that are suitable for the patient condition. Also, things like positioning and proper documentation in nursing. And proper documentation in nursing is very vital. Thank you for watching. Stay tuned for another video.